For Profhilo injection, we inject them onto 5 points in each side of the face. These are what we call bioaesthetic points. These bioaesthetic points are specially chosen because they are away from major nerves as well as vessels in the face, and diffusion studies have shown that by injecting it into these points within 24 to 48 hours, there's effective diffusion of the HA throughout the whole face. So let's now go through where these 5 points are. The first point is called the tragus. So you look for the tragus of the patient. The injection point is about 1 centimeter anterior to the tragus of the patient, here. The second point is known as zygomatic protrusion. You look for the maximum zygomatic protrusion of the patient, and the point of the injection is usually slightly lower than the maximum zygomatic protrusion of the patient, somewhere here. It is important to note that this point should be at least 2 centimeters away from the lateral corner of the eye, and should also be away from the malar mount of the patient if the patient has malar mount, because injection into the malar mount may worsen the edema. The third point is what we call the nasal base. This is identified by a line that we draw straight down from the mid-pupillary line vertically downwards, and another line joining the nasal base to the tragus. The midpoint of this line is the nasal base. The fourth point is the chin. Here, what we do is that we divide the chin into thirds. The upper third, middle third, as well as lower third. Then you draw a horizontal line across the upper third of the chin, and the injection point is usually about 1.5 centimeters away from the midline towards the oral commissure, somewhere here. The last point is what we call the mandibular angle. Here, you palpate the mandibular angle of the patient, and the injection point is about 1 centimeter anterior to the patient's mandibular angle, somewhere